Doctors and nurses, have any of your patients surprised you with their amount or lack of pain tolerance? A friend told me an old boy came in with a large laceration on his arm. Suturing it up took over an hour, but can be quite fun as you can chat to the patients. My friend was engrossed talking to him about his experiences in the Second World War and really enjoyed treating him. The old chap was in good spirits throughout and told him lots of interesting stories about his time behind enemy lines or in trenches in Flanders. After he put the last stitch in, my friend started clearing up and found the local anesthetic bottle unopened. He realized he'd not put any local in at all, and yet the guy didn't once flinch, leave aside complain. When asked why, he didn't say anything. He just said, "Oh, I thought that's how it's supposed to feel. I didn't mind. Lovely chatting to you." Then walked out. Don't make him how they used to point lignocaine edit. Spoke to my friend last night. I totally didn't do this story justice. The laceration was sustained in a machete attack. 2 guys tried to break into the man's house and one slashed at him, but he fought them off long enough until a neighbor started to run over and they scarpered. Such a relevant detail. How could I have forgotten? He had to clean the wound out thoroughly, which is even more painful than suturing. And to those of you pointing out the Flanders inaccuracy, that's purely my incorrect paraphrasing. It was WW2, so ignore the trench comment. I'll refrain from the obvious "I'm a Dr. Jim, not a historian" line. Or perhaps I won't. A doctor here. My intern year in residency, I saw a 17-year-old kid who, when while playing hockey, tried to stop a puck with a gloved hand. It struck his fingertip, injuring the base of his nail, causing a significant deformity. His nail bed needed repair, which requires first removing the nail. That is done by bluntly dissecting separating the nail from the tissue below it. If your stomach didn't turn reading that and imagining it, congratulations, you have no soul. Typically, we use a numbing agent to eliminate sensation to the entire finger using something called a digital block. I put it in. After 10 minutes, he still felt me touching his fingertip. I tried putting some around the nail. He still felt everything. His mother said his father actually had a similar thing. Lidocaine didn't work on him. I offered him a different numbing medicine. We can inject Benadryl in that case, or even knocking him out. He looked at me in the eyes and said, "Doc, just take it off." Without anything. Yeah, it's fine. They fix our cuts without numbing medicine, but it's gonna hurt a lot. I have to scrape. I know, so I went at it. He grabbed a towel with his other hand and I went to work. 45 minutes later, the nail was off. He was repaired, and I replaced the nail in its rightful place. The kid didn't even make a noise. TLDR, hockey players are faking badass. Not a doctor or nurse, but this happened to me. I completely shattered my knee and part of my leg after I was running and slipped on some ice into a stone wall. I was with a group of friends and all they saw was me slide and hit the wall. They came over and asked if I was okay. In a normal voice I said I couldn't move my leg. No tears, screaming or anything. No one believed me, but after a minute or two I convinced them to call 911. The whole time I was waiting for ambulance, about 30 minutes, I was talking to them normally and no one believed I was actually hurt, until I started going in and out of consciousness. Right as the paramedics got there I started to wake up. They got out, and they didn't think anything was wrong, until they cut my pants off, and saw my femur was almost protruding out of my leg. I had no kneecap, and tops of the tibia and fibula were protruding out. They took me to hospital. No drugs in the ambulance, as I was joking around with them, that is asking if I'm allergic to anything. I told the apparently stone walls. They got me to hospital, and rushed me into where the doctors came over, and were shocked I wasn't screaming or crying. Then about an hour after the initial injury the pain finally started, and once they started moving the leg about 3 doses of morphine, because one wasn't enough, and one of Demerol. I don't remember the next couple days besides bits and pieces. But all the nurses and doctors told me I had one of the highest pain tolerances they have seen. Although I imagine it wasn't really my choice, mostly the brain just shutting it down, because I was in so much shock, and had so much trauma. I'm so there with you. I can't take most pain meds. Anything in the opiate family is either going to make me really sick, or do nothing. Morphine? Like I didn't even take it. Percocet and Demerol? Bring on the vomiting. If I go into the ER for pain, even though I tell them that I can't take opiates and only need extra strong ibuprofen or something like that, they still treat me dismissively. Well, then your pain can't be that bad. This was the ER physician's reaction when I came in with meningitis, which was more painful than childbirth. So maddening. I should note that I have now recovered from 3 surgeries without opiates. It hurts, but not as badly as people might think. We've come to think of any pain as bad, but most things are tolerable if you can take that upper edge off. I recovered from sinus surgery with no meds at all because I couldn't take ibuprofen and Tylenol does nothing for me. I lived. Lots of ice packs to the face. Unfortunately, doctors and nurses sometimes freak out about my lack of meds, even with a pain plan. Twice I've woken up on opiates after surgery, despite my insistence that I can't take them, and had to argue to be allowed to stop taking them. Pain is pretty mysterious and scary, even to medical professionals, and I'm a 43-year-old woman, I should note, not a 20-year-old man. Not an ER doc or nurse, but I work side by side with an ER doctor. I saw an 8-year-old boy come in with a compound fracture to his left humerus, upper arm. First thing I noticed was him strolling in, not a tear or grimace on his face, blood pouring down his arm and a bloody rag held down near his elbow. First thing I thought was he probably had a decent laceration to his arm. Pretty tough, but nothing too impressive. Point I get into the room and see that the rag was removed, and holy shit, that's a bone sticking out of his arm. How the hell is this kid not bawling, and how the hell did he just walk into the ER, barely cradling his arm? Right then I knew this kid was tough. Little did I know that he was about to become Superman. So I'm sitting there admiring this gruesome wound and listening to his backstory. Apparently the kid was out with a friend riding a 4-wheeler when they accidentally drove into a ditch and flipped the vehicle. Kid was thrown and the quad rolled over his arm. This was about 4 miles out in the middle of nowhere over bumpy dirt trails. So of course he just jumps on the quad and rides the 4 miles back to his house with a bone sticking from his arm. Then has his dad just leisurely drives him the 30 minutes into town to the hospital and strolls on in. Best part, when the doctor said that they needed an x-ray of the arm, he just casually asks, "Before you move it, can I get a little pain medication? It sorta hurts." Most badass 8-year-old I have ever seen. I don't think my pain tolerance is really any higher than normal, but I've surprised a few people. When I was about 5 years old I fell and took a pretty good chunk of skin off the side of my head. We went to the emergency room. I was still crying pretty loudly and got into the room. My dad pulled the doctor aside and told him, "Don't surprise him, just tell him exactly what you're going to do and you'll have the best patient ever." So the doctor did. He explained that he'd have to shave around the wound, scrub it with a brush to remove any dirt, clean it again, and then bandage it. I said okay, and let him get to work. I sat quietly, wincing occasionally while he scrubbed my open scalp, but didn't cry or freak out. I knew exactly what he was doing, so the pain was completely expected, and I saw no reason to really react. The doctor was absolutely amazed and said he'd try that with all his patients. The 2 other times are more recent. One was a 6.5 out of 2 session with no breaks, after which my artist called me a psycho. The other was when I broke a bone in my hand and told the ER doc that my pain was maybe a 3 or 4 on their scale. Edit. Remembered another one. I split my scalp open on the antenna of an F-18 and needed stitches/staples. It was almost 3 hours before a doctor was finally ready to start stapling me up, and by that time I was sick of waiting, whilst losing blood. He realized he had forgotten the numbing agent, and I told him, "Doc, look at how many tattoos I have. Do you really think a few staples are going to bother me?" He looked a little horrified for a moment, asked me if I was sure, and then finally stapled me up 10 staples. Not a doctor, but once I was bouncing at a club in a historic part of the downtown district, where my college was located. Being in the historic district, the building had high ceilings and big tall windows with thick, heavy glass. One night some kids got upstairs and decided it would be a good idea to kick one of the windows out, right over top of the crowded smoking patio out front. I felt a great weight come down on the top of my head and heard the sound of breaking glass. I thought, being that it was a pretty rough bar, that someone broke a bottle over my head, so I turn around raising the dukes and ready to fight, when I feel what only could be described as my ear peeling off the side of my head. What had happened was, a shard of glass about an inch wide, and over a foot long connected with my head at the topmost point, of where my ear connected to my head, slid down through my ear canal, and lodged in the back of my jawbone, making it impossible to close my mouth properly. I turned to my boss who was standing next to me, apparently, because I don't remember this next part, this is what bystanders told me, and said, "Hey Mike, would you pull this out for me?" Went to the hospital, got stitch sans numbing aid, and made it back to the bar before close for a beer. TLDR, piece of glass almost cut off my ear and part of the side of my face. Got stitched without numbing agent, went to get a beer after. I was a patient, my appendix burst, and I didn't know that the main diagnostic criteria for appendicitis is pain. Doctor poked me and asked if it hurt. It did, so I calmly answered yes, and described the pain as best I could. He told me that, if it was appendicitis I would be writhing in pain, and send me home. A week or so passes, and I got sort of better, but it still hurt. Then everything suddenly got a lot worse, buffing up bits of digestive lining from both ends. Pain at that spot got noticeably worse, etc. So we go to the hospital, where they order x-rays this time. Doctor/x-ray tech looked at my x-rays, and got this kind of stunned look and went, surgery? Like right now? Asked when I started getting pain there, and when I said over a week ago, there was this moment of, you're not supposed to still be alive/why didn't you go to the doctor sooner? Explained about my lack of reaction to being poked there. Oh, you must have a really high pain tolerance. Wait, do they have you on any painkillers now? No, I'm fine. I was actually in really good spirits, because my digestive system hadn't worked for a week and they were giving me fourth nutrients. Anyway, got surgery, where they discovered that the reason I'd lasted that long with appendicitis is that it formed an abscess after bursting the first time, sort of temporarily patching itself, and when the abscess burst as well as when things got really bad. All through the recovery they kept offering me painkillers, and having to tell them so many times that I didn't want any got annoying. I came out of that with a reputation for having a crazy high pain tolerance, but years later, totally unrelated, I managed to stomp on a piece of glass, and when they put stitches in they managed to run one through a nerve or something. Had stitches before, was never a problem. When they took it out later, I doubled over screaming, completely involuntarily. Weird experience, hearing yourself scream and taking a moment to process that you'd made that sound and there wasn't a thing you could do about it. So I'm not able to control all pain. Sorry I'm late to the party. I have so many. Working at a level 1 trauma center is awesome. We had a guy get his arm ripped off by some sort of tractor. He then drove this tractor to an EMS bay and asked them if he could get a ride to the hospital or if they could take him back to his car since his tractor is too slow. Also had a guy fall down a ravine and fracture his tib/fib. He crawled up to his truck, used his shotgun to push on the pedal, and drove himself to the hospital. Had a girl fall on her steak knife during dinner. Came in 24 hours later because her cut wasn't any better and she was afraid she'd need stitches. It was 6+ inches deep into her abdomen. She went straight to the OR. I think there's been probably 5 or 6 people I've seen who come in with MES, heart attacks, and they are totally chill before any meds. I've learned the longer the problem list, the less they're able to rate their pain, because even getting in 4th is 20/10. Which, by the way, the scale only goes to 10 point, so I made up a scale of my own, since people can't seem to understand point 10/10. You are actively being mauled and ripped apart by a bear. 09/10. You weren't wearing a seatbelt and have been in a rollover accident at high speeds and have multiple broken bones. Being shot through the abdomen or stabbed once. 08/10. Giving birth without medications or an epidural. For men, ureterolithiasis, kidney stones not in the kidney anymore, akin to swallowing attack. 07/10. Heart attacks, ischemic bowel, blocked blood vessels, essentially. 06/10. Appendicitis, chaladochilithiasis, small bowel obstruction, Intussusception. Abscess to the genitals 05/10. This is where most people experience pain, at worst. I didn't bother going below this. Fibromyalgia is around here. Edit. Thought of one more. My least favorite case was one who passed away. Guy's car exploded on him in an accident and his car was engulfed in flames for over an hour and everyone thought he was dead. He was alive and conscious, and only rated his pain a 0.9, despite having basically 90% burns throughout his body. Shortly after he decompensated, was placed on a ventilator and terminally extubated the next day. Not the doctor or nurse, but when I was about 3 or 4 years old I came down with something bad. My mother is a narcissist, politely put, a rather selfish emotional woman child. I was neglected for I don't know how long. One time, I remember feeling sick and not eating or drinking. I eventually became so weak that I couldn't walk. Ma saw I wasn't responding to her and gave me a grape ice pop to try getting me to talk to her. I puked it up. Still wasn't responsive. She got pissed about how withdrawn I was being and yelled at me. Got close enough in my face to feel the heat coming off my forehead, so went and took my temperature. I looked like hell at this point. Raccoon eye circles, dry lips, pale/bluish skin. She freaked out when the temperature came back as 105 and took me to a clinic where they sent me to the ER and huked me up to and forth to rehydrate me and made me stay in a hospital bed for a while. I had pneumonia and severe dehydration. I never complained or thought I was bad off. I sat blank-faced and limp for the whole ordeal. My veins were so tiny the nurses stuck me a bunch of times and dug around to get it right. The outcome was horrible. To this day grapes make me sick. I can go without eating or drinking to the point of starvation and severe dehydration unless I remind myself, and I had an incapacitating phobia of needles and veins. Another time I didn't go to the ER, but was mauled by a horse that wasn't mine. The horse managed to pick me up with his teeth and threw me. I was rattled and dizzy, but didn't really worry or feel pain. My left side was briefly paralyzed. I calmly got up off the ground and unlocked the gate to get out of the horse's stall, closed it behind me, just feeling nauseous and pissed that my left hand wasn't working. I called my mother so she could drive up and get me, as I had walked about a mile off to take care of this horse. She instead raged about how I had gotten myself hurt, demanded I walked back this instant, and hung up. So, I made the walk back over the fields and through more gates. Didn't know how bloody and dirty I was. Once home, I realized my shoulder was bitten up and reluctantly let my mother see it. I told her my hand wasn't really functioning. She insisted I take a shower. Now, once there, the arm started to ache a bit and feel uncomfortable. When finally at the clinic, x-rays came back and revealed that I had broken both my ulnar and radius. Clean across, as in, about an inch of the ends were free. The only thing holding my wrist sort of in place was that the ends were shoved at an angle that made my wrist dip down. They put on the splint wrong and referred me to a specialist the next day, since, hey, I didn't feel too bad. Haha. I was really sick the whole night, puking. I went to the hospital and the pain finally set in when they had to re-break my arm and set it in the opposite angle to make it heal correctly. Weird cast. I had my hand in some kind of swoop claw position for 3 months. Apparently I should gone to the ER the first day. Not a doctor or nurse, but my wife just demolished her ankle last Sunday. I mean demolished. We were helping her brother move. I was at his new apartment with him offloading the U-Haul. My wife was at the old apartment grabbing the last of the miscellaneous crap to put in her dad's truck. She was walking down the stairs and missed the last step while carrying a small empty ice chest. She rolled her ankle and destroyed it. I got the emergency room and realized it was bad when different nurses kept coming in to look at it. But it didn't look that bad. Anyway, she had surgery early the next morning, 4 hours, 3 braces, and 14 screws later her ankle is fixed. The first 3 days in the hospital were hell. My wife has a ridiculously low tolerance for pain, so we were expecting the worst. I warned the nurses and they were really good about trying their best to keep her comfortable. But keeping her comfortable seemed impossible. She was in constant pain. I don't mean just moaning and groaning. We are talking damn near hyperventilating, crying, and yelling. Other patients were hitting their nurse buttons and telling them to help. That poor girl screaming. None of the pain medication seemed to work. We thought it was due to her low tolerance for pain. No, it was because her body could handle a ridiculous amount of pain medication. Her surgeon came by to see her on day 2, and we told him about the constant pain. He said the anesthesiologist had to use a sheet load of gas to get her to sleep. So when the nurses heard that, they started hitting her with enough medication to enrage the giant at ease. Finally she was comfortable. But poor girl has no tolerance for pain, yet her body requires a ridiculous amount of pain meds to numb the pain. Not a doctor, but I saw one of my friend handled his wound when we was in high school. After a soccer match, it was rained hard, so we went back home. The rain flood ankle deep and the street looked like river. There were lots of manhole and construct on the way, and my friend fall in one. It was small and full of metal bars. His right leg was stuck. We couldn't see anything because of water. There was no one around for help, and it's rained harder and harder. After 20 minutes trying to get my friend's leg out, we realized that at least 3 or 4 construction steel bars was thrust deep into his leg. My friend freaked out and started to lose patience. He decided to pull out his leg, didn't give a shit about the wound. We counted 1, 2, 3, and he pulled it out. The moment I saw the leg, I told him not to look at it. Besides several small cuts, there was one big hole below his right knee. It cut so deep I can see his bone, yes his bone, and it bleed like a fountain. The scariest part was that flesh from the cut still stick with his leg by a small piece of skin. That red piece of meat, with the size of a small banana, swayed like a pendulum the moment my friend started to stand up. He saw it and tried to fit it back into his wound. I was scared shitless and told him we should go to the hospital. I carried him to a nearby clinic and a doctor sewed the flesh back. He didn't say a thing, called her mom to pick him up. Weeks later I asked him how did he feel at that moment. He said he too scared, couldn't feel anything until he arrived home. His leg healed fast. Now it has a scar big as a banana on it. P/S. Sorry for my English. I'm from C. Worked as a firefighter/EMT for 3 years. Went through paramedic school and was in the process of getting signed off when I left for multiple reasons. I've seen both ends of the spectrum. People that looked tough break down and the weak looking ones not say a word. One of the most memorable was while doing a rotation in the air for medic school. I'm in Central Florida's level 1 trauma center. Locals know where I'm talking about when they fly in a guy with multiple lacerations to his fingers. Sounds innocent enough. Turns out he was cutting wood when the blade kicked a piece into his face. He reacted by reaching out, unfortunately into the blade. I watched the neuro exam where he couldn't feel anything in the affected fingers. He rejected all pain medicine and refused to look at the wounds, claiming it was his stupidity that caused it all. It's one thing to have irreversible damage to something you use on a daily basis. It's another to beat yourself up over it. I felt for the guy, but punishing yourself in a situation like that isn't healthy. Another was a call I was on while on duty. Motorcycle vs SUV. Arrived on scene to find the motorcycle rider was missing his foot a couple feet. Goddammit, no pun intended, away. Completely unresponsive. We log roll, expose, incontinent, become semi-responsive part way through the call. He looks at my medic and asks if his leg is okay because it feels funny. While his foot is sitting in the bag I placed it in next to him on the stretcher. They flew him out. He survived and apparently ran into another medic of mine that was on scene in the grocery store. On the other end of the spectrum, you have grown-as men crying because they've had body aches for 3 weeks. If it's one thing I learned in those 3 years was not to judge what is going on with a person. Pain is a subjective thing influenced by several factors. Doctors can be so uncaring. There's only one smaller here. I have chronic conditions, a ton of them. One of them is so my stomach is semi-paralyzed. It's called gastroparesis. There are pain attacks associated with it. They are horrible. I mean, think of passing a stone or giving birth, or they feel like that all put together. They can last hours. I know that there isn't much to be done about them, so I usually treat at home with the pills that I have. I have enough opioids to kill many. My doctor knows I'm very responsible and undertake my meds way too often. It's all in my chart at the year 2 point. For the first time being here in 2 years, I had to have an ambulance called 2 or so weeks ago. That pain attack was the worst I ever had. It was also different as the pain went from a nerve all the way up to my neck. That never happens. Well, I get there, they make me wait forever, and I have to fight with the doctor, and 3 hours later, when my pain is actually gone, I get a shot of Toradol. I now know better than to ever go back to this. It's written in the instructions what to give me if this happens. 4th Dilaudid, maximum dose and something for the nausea like Zofran. Nope, she watched me suffer and cry and scream for 2 hours. I mean, at one point I was looking for objects to kill myself with, that's how bad it was. The doctor wouldn't have cared less. Can't hand out too many opioids. Let's let the patient suffer. First time in 2 years in that for pain. If I wanted to get high, I have all the meds and more at home. Not a doc or nurse, but I was an EMT in paramedic school, doing some shifts in the ER. We had an 18-year-old girl come in with a sore throat because the Walgreens clinic line was too long. Yep, she came to the ER in the middle of the afternoon on a weekday for a sore throat. Wish I could have been there when her dad got that bill. Well, I went to start 4th access on her using a little 18 gauge. She shrieked and screamed loud enough to hear across the entire ER. And it wasn't because I'm bad at 4ths. She was just a whiny little girl. On the other end of the pain spectrum, we had a guy come in by ambulance one Tuesday morning. He had decided to start his week off with some beer and whiskey at 9 or 10 AM on Monday, and then proceeded to drink for 30+ hours without sleeping. He got in a fight with his drinking buddies over something, got knifed, and kicked out of the house. The ambulance found him sitting on the curb, smoking a cigarette and drinking a beer. He had no shirt or shoes. He also had multiple lacerations across his chest, stomach and back. Most were 18+ inches in length and over 0.5 inches deep, bleeding like a stuck pig. Calm and courteous, the EMT told me the only thing he wanted was a couple minutes to have a last smoke before they loaded him on the ambulance. As he was obviously in a fight, the police showed up to take his statement. The officer told me that this happened to the guy a few times a year, only the last time he had been shot instead of knifed. Didn't want pain meds, didn't curse or cry, just sat there on the bed politely. Late to the party, but I'll throw this in the mix. I'm not a doctor, but I had a situation that should go in this thread. My sister used to shoot meth, still does, but used to too, and I would do it with her as well. She had the needle in her vein and injected the whole shot, which was a decent size, probably around 50 units. Pulled the needle out and, well, there was no needle. It was broken off in her vein. Hospital was out of the question at first, but we knew we had to get that needle out of there before it got sucked into her bloodstream and into her heart. She, my sister, was high as hell, but knew the situation could get serious. She grabbed a razor blade and slit her elbow open and started digging with tweezers and fingers trying to find this needle. We were all high too, so we started helping. After about 30 minutes of digging and no luck, I got scared and told her I'm getting help. She was still very high but agreed. I called my grandfather and he took her to the hospital to have the needle removed. Throughout the 30 minutes or so digging, she never flinched and watched the whole thing. She was the main one participating. I'm sure it was the dope numbing it, but watching it was only bearable while I was high. Her thumb and pointer finger would dug into her elbow feeling around searching for this needle. I'll never forget that sight. Point now for the questions that may come after you read this. After a hab, she never stopped shooting dope. Still does to this day. I met a girl who I fell in love with who gave me a choice between her and dope, and I'm a family man now with a good job and regretful past. I know I'm late, but I really hope people see this. I'm a long time lurker, and I made this account specifically so that I could share this story. When I was still a med student, I was training in the emergency room at the hospital near my campus one night when a girl came in at around 9 PM stating that she had a cut on her leg she thought might need a couple stitches. This girl was all smiles and very calm. She was probably about 15, very polite, and was walking completely normal, so I figured she might be exaggerating the seriousness of the injury a bit. She stated that she had accidentally cut her leg a day ago, but didn't want to come in as she didn't think stitches were necessary at the time. Then she was at soccer practice and got cleated quite hard where the cut was and it split back open. Her parents were away, so she got her friend's dad to drop her off at Emerg. I asked her if I could take a look and she replied with a cheery sure. She rolls up her pant leg, slides down her sock, and on the side of her calf was a 4 or 5 inch V-shaped cut that went right down to the bone. So I gave her an anesthetic and began stitching her up, and I told her she might not want to look. She said it was fine, and that she was curious anyways, and sat there watching me stitch it the entire time. Then she hopped up, rolled her pant leg down, thanked me, and then called her mom's friend for a ride home. That was, to this day, the ballsiest teenage girl I've ever seen. Not doctor here, but patient. Point: about 6 years ago my appendix burst, but I walked around with it for 5 months. When I finally went to the ED on the 3rd flare up, they were kinda half-assing it, because I told them I had a few drinks that night, and I was just kinda sitting around looking uncomfortable, so they must have, though I was either overreacting by being in the ED or drug seeking. Took care of the second when I said the pain was 6/10 and refused meds because my plan was to drive home after if it was nothing, and I didn't want to wake a family member up at 4 AM to come get me. They finally get enough of the ever so lovely contrast dye in me and get me in for a CORT scan. 20 minutes later a panicked looking doctor comes in, tells me I'm having surgery right now, and asks if I have a preference on the doctor. I mention a local surgeon I've had work on me before and we're off. Finally accepted a shot at Dilaudid at that point. I woke up 6 hours later from what was supposed to be a 45 to 60 minute procedure. First words out of the surgeon's mouth when he sees me a few minutes later were, "You should be dead and I should be talking to your grieving family." Apparently, he popped the camera in full laparoscopic, turned on the light and all he saw was white. Converted to traditional opening with a massive incision, literally about 6 inches, full peritoneal lavage, JP drain point. Then he asked me if he heard right that I had driven myself in and refused pain meds. When I told him yes, he said, "With the way that thing looked, you should have been lying on the floor, screaming in pain and lucky to crawl your way over to the phone to call 911 and have them break down your door to bring you here in an ambulance, not hopping in your truck and cruising down and strolling though the front door." When my little sister was 7 years old, she was riding her bike with flip-flops on when her foot slipped off the pedal and ended up getting sliced between a spoke and the back bar of the bike. It pretty much filleted the bottom of her foot in a semicircle around her Achilles tendon to where the back half of the bottom of her foot was hanging off. This just happened to occur right in front of the home of her elderly retired nurse, who wrapped it up with a towel and called for an ambulance and then called our home phone. We rushed to her in a panic, and when we got there she was sitting there in a lawn chair with her foot elevated, playing Pokemon on her Gamma Boy, not a sign of tears. I rode in the ambulance with her to the hospital and the EMTs were astounded by how calm she was. She was also fine as they stitched her up. The doctor said if it was a fraction of an inch higher she would have lost function of her tendon. I don't know if I'm explaining this sufficiently. It's kind of hard to describe, and I have no medical training. I just remember being like, "Damn C's, you're a badass little kid." Edit. Autocorrect also forgot a part of the story. My sister walked down the sidewalk and up this lady's concrete driveway before the woman noticed her, and the bloody footprints were visible on the concrete for weeks after. Not a but have a good story about my dad. He was a construction worker and had a few accidents back in the day. One in particular that caused the staff to say, "What the fuck man was this?" My dad was working on some scaffolding about 3 stories up. Apparently the guy who put up the scaffolding didn't secure it properly. It came loose, causing him to fall 3 stories onto a pile of metal rebar, which actually impaled him through his side. Essentially the metal bar went through his lower right back and exited his lower right stomach. Since he was one of the last people there that day, he realized calling for help would probably not do anything, and this was before cell phones. So he decided to pull himself off the bar, use his shirt to tie around himself to cover both the entry and exit wounds, then drive himself to the hospital. He was very lucky to have missed all internal organs and surprisingly lost very little blood. I remember this very well because he came home from work that day like nothing happened. My mom asked why he was late and was about to give him heck because we all had to wait for him to eat when he took off his shirt and had the bandages on both his front and back. Another time he was working on our farm's silo roof when he slipped and fell. As he was falling he grabbed one of the metal ladder rungs near the bottom of the silo in time to stop him from falling to his death. He did however manage to dislocate his shoulder. He refused to let me mother drive him to the hospital. He drove himself to have them put his arm back into place. Another time he was doing construction repairing pipes in a ditch when the ditch collapsed in on him. The dirt pinned and crushed his ankle against the metal pipe. He had to wait for his coworkers to dig him out while his ankle was crushed. His coworkers, also friends, told me that he kept making jokes and laughing at them the entire time because they were more panicked about getting him out than he was. And another time on the farm this dumb cow would not move to where it needed to go. My dad got very frustrated and ended up punching the cow in the head. The cow actually wobbled and had to take a knee. My dad broke several bones in his hand though. My mom said no one won that fight, but seeing my dad almost KO a cow with one punch made me believe he had clearly won. That cow moved every time after that without issue. I have one. As a patient. I was badly burned at 13. Took over a year to fully heal. In the past 15 years I tore my rotator cuff and injured my knee, so I've had persistent pain for years. It just doesn't really matter that much anymore unless something is actively being made worse. A year ago, I was resurfacing a table. Sanded it down, was flipping it over to sand the bottom, and the table was resting on top of cardboard on the workbench. When I flipped it, the bottom slid out away from me, and in trying to catch it, my right arm's thumb caught around 100 pounds of the weight. I didn't know what happened, but it hurt. I assumed I sprained it, so I waited to see if it got better over the weekend. Happened on a Friday. On Monday night, I was pulling on my thumb and I pressed on the first joint off from the wrist, which was pretty swollen, and with a loud pop the joint went back into place and seemed far less swollen. At that point I said, "Fuck," went to the doctor, saw 3 people, all basically said what I claimed happened was impossible, and I only sprained it. Gave me a thumb spike and told me to see if it gets better. 9 months later my hand is badly swollen and hurts all the time. I go to urgent care. He sent me to a specialist. While I'm meeting the specialist, he has 2 doctors doing their residency, so he just kinda stands there while they talk to me. I tell them what happened. They look at each other, then look at the specialist and say, "Okay, that can't be possible. He has to have sprained it, right?" The specialist says to them, "Let's find out." He walks up to me, takes my hand, and starts to mess with it. He moves it around and asks what hurts and what doesn't, how far I can move it in certain ways. He feels along it, provides resistance and tells me to push as hard as I can with certain fingers, etc. After about 5 minutes of that he turns back to them and says, "No, he dislocated it, or subluxed it at the very least. This will need surgery, but let's get some imaging." In June I had surgery. In July, I started physical therapy, and I had to retell how it happened to the PT doctor, who kinda stared at me for a few seconds and then said, "Okay, while you're here, if anything you are doing hurts, stop doing it. Okay?" He then told his intern to be careful with me because I won't say when to stop. I just kinda sat there awkwardly. Honestly, the only reason I didn't go to the doctor is I figured they would just tell me to come back in 3 or 4 days anyway. It happens 9 times out of 10 that I go, and I didn't want to waste money on a copay or gas. This one comes from me by experience. After reading the appendix stories I've got my own in the 5th grade. I ended up with a bad flu around March time, and I was out of school for a solid 2 weeks before I went in to see the doctor. He sent me home with the faking flu. I went in 2 weeks later with an appendix, or what was left of it, having been ruptured for a solid 3 days, and no food or water had gone into me because everything that went in came right back out before I could swallow it, and with a nice side of bile to top it off. I wailed into the air holding my mom's hand and the doctor's jaws all dropped to the floor, and I was immediately put into intensive care for another 2 weeks. All in all, I was in the hospital for 9 weeks dealing with all the complications. A ruptured appendix, can dish out. None of the doctors or nurses had ever seen anything like it. Kidney failure / liver and intestinal infections. Hell, I was living off a banana bag for a good week and half before they moved me up to jello and beef broth. Out of the whole ordeal, the worst part for me was that goddamned infection juice filled drain ball that they had stitched into my abdomen, and I only dropped it once. One time was enough for me to pin the damn thing to gown. When I took a piss in that frigidus bathroom. I suppose I could deliver story part 2, since I'm already this far down the page as well. When I was 7, my dad, sisters, and myself were visiting my great uncle. And I were riding around on his 4-wheelers. And of course, as a kid I couldn't get enough. The day had come to an end, and since the second wheeler was out of gas, we piled 5 people onto one. 3 people on the main seat and 2 on back holding onto the luggage rack as we took a steep ascent up the drainage ditch in front of our house. They have a name, but I don't remember it. The whole thing flipped straight backwards, and it seemed everyone made out okay. Aside from me, what happened was a key landed directly above my eye and had torn a solid 5-inch gash into my forehead. Bleeding everywhere and freaking the fuck out, 7-year-old me waited for my father, who had witnessed the whole thing happen from 10 feet away, to come push the thing off of me so we could walk together back up to the house, where I sat on the stoop and waited for the ambulance to come from the nearest town an eternity later. I have no idea how long it really was. The ambulance got there and they bandaged me up and took me in. All in all, I got around 100 stitches and they used surgical glue to prevent the gash from pulling apart from the sutures. One thing I remember vividly was the walk back up to the house, and everyone had made a path for me similar to what you see in a sports movie, and the looks on their faces made me truly realize the extent of the injury. A few people threw up or passed out just from glancing at my head. The really scary part is that I have the pictures from the operating table with tubes in my throat and blood everywhere, but I don't have the nerve to look at them. Nobody does. They remain sealed in an envelope, save for the one time my grandmother opened the mail to see what was inside it. She strongly suggests we do not open it, but as each day goes on I get more and more tempted to see my own face in a torn bloody mess from the day that forever disfigured me, leaving a huge scar on my head and permanently causing my eyebrow to be patchy and misshapen. Well, may as well give this a shot, even though it will just be buried. I read someone else's personal story, so I thought I'd share mine. I'm a gymnast. I was on the high bar doing giants, a skill where you swing all the way around the bar. If you've ever seen the Olympics, it's the swing in between most skills. For high bar, we wear leather grips on our hands with dowels to help us, well, grip the bar. The flaw with them, however, is that if the dowel rolls up under the grip and gets caught on itself, it will literally lock up and not move at all. Grip luck. This happened to me, so I turned to slow my giant. Turned out doing this screwed me over, and a loud snap resonated through the gym. My teammates all rushed over, and as I'm hanging with my arm literally wrapped around the bar, I say, calm as can be, "Welp, I just broke my arm. Someone get me off this bar please." It's all a blur moving from the bar to a mat. It all happened so fast. Luckily, once they got me on a mat, there was a doctor present, one of the girls' team's dads. He came over to us the damage, and the first thing he asked was, "Are you sure it's broken?" It looked like I had an extra joint in my wrist, bending at close to a 90-degree angle. Kinda pissed me off that he had to ask. I sorta just stared at him and said, "Yeah, pretty sure." Once they removed the grip and he saw, he agreed and started talking about how bad it was. At this point I started to tear up, not from pain, but from fear of the end of my gymnastics career. Then I went to the hospital. Not a doctor here, but heard a story from a female friend of mine about her friend, also girl. Read on, if interested. This happened about 5 years ago. Her friend, let's call her Lucy, was with her ex in his Jeep, driving at night at high speed. Both were somewhat drunk, but the dude was near wasted. Naturally they crashed. The Jeep was a large and heavy, so it pummeled a concrete light pole near the sideway. The pole gave in and flew away, but not until it smashed the front of the car. Lucy put her arms in front of her face just before the impact. Her face was okay, but the glass shedded her arms. Also her legs had open fractures because they hit the floor and the seat pushed her from behind. Yeah, they were speeding. The dude was unconscious, bleeding all over the place, but she couldn't tell whether he had fractures. He did. She pulled out her phone and called an ambulance with a rescue team. Within 10 minutes they showed up. As they were trying to pull her out, she kept shouting at them how firmly they pulled her. Then one of the rescuers said that her ex was dead. She yelled at him, saying that he was breathing a minute ago and that he'd better pull him out ASAP. They had to cut the jeep with a saw to pull him out. He was still alive. On the way to the hospital she kept yelling at the driver to go slower, since every bump was hurting her. She even sat up a little and threw a syringe at him, since he didn't respond. At that point the paramedics were a little afraid of her, because she kept yelling at them for causing her inconvenience, and they couldn't give her any sedatives to put her out, since she'd better be awake. Once they arrived at the hospital, this nurse brought a rolling table and put her on. The hospital had small tiles on the floor, and as the table was rolling it kept bouncing. She yelled at the nurse and threatened that if she doesn't maintain the ride, she'd have her fired. That nurse was never seen anywhere near Lucy afterwards. Need to add that Lucy has connections. Her dad is a big shot. This whole episode was confirmed by several eyewitnesses and by Lucy herself. She laughed at it at the time, but man, was that girl hot and mean. And I'm not talking about some sort of a biker girl. She was tender and sweet. The final count was a broken pelvic bone, 2 broken thighs, lacerated skin on the forearms, and 2 broken ribs. Oh, and on the way from the wreck to the hospital, in between her criticisms towards the medical personnel, she kept calling her relatives to let them know about the accident. TLDR, a female friend of mine got into a car accident, broken pelvic bone, 2 broken thighs, lacerated skin on the forearms, and 2 broken ribs, kept telling the doctors and rescuers how to do their job. I was in grade 8 when in gymnastics class I dislocated my kneecap. What I felt immediately was nothing. I was just confused. Why wouldn't my leg hold my weight? I looked down to see my crooked leg. I started screaming because I thought my leg was going to need to be amputated. I was not in so much pain, although I was uncomfortable. It took about an hour for the paramedics to come and get me situated in the ambulance. I just laid on the gym floor with my friends circling over me, talking to me, telling me how disgusting my leg looked. The ambulance ride I remember being bumpy and not so much fun. I don't remember much of my visit. I think I was pretty quiet. They placed an 4th catheter immediately and gave me something. I don't remember much after that. X-rays were taken. I slept until suddenly 10 people walked in the room. I felt a little panicked. Why were there so many people? Am I dying? Then everyone held me down and they popped my kneecap back into place. That was horrible. The pain meds had worn off by then. I was fully awake after that. They even made me walk immediately after. I couldn't. I think all I took for pain after that was some NSAIDs. Physiotherapy for 6 months. Crutches 2 weeks. And I don't remember shedding a tear. I have seen other threads and YouTube videos of men having the same thing happen, saying it was the worst pain of their life. But I honestly don't remember it as being that painful. It hurt for sure, but being 12, I think I handled it well. I'm not in the medical field, but a couple years ago I watched my mom tough through some insane pain. She has always had high pain tolerance, had her gallbladder out at 22 and the nurses were practically begging her to take pain meds after surgery. Anyway, so we are leaving on a road trip to see my grandfather who is in the hospital and doing poorly. 7-hour drive. She comes down the steps in the garage, slips, and falls. Says her ankle hurts. She has gone white as a sheet and nearly passed out when my dad tries to help her up. I've never seen her like this. Pretty sure we should take her to the hospital. She won't have it. It is probably just sprained. She hobbles to the car and off we go. At one point we stop to at a rest stop and she is walking up the bathroom leaning on my dad. Old cowboy notices, comments. She says it's just a sprain. He says, yeah, if it were broken, you would be screaming. Haha, back in the car for a few hours, finally reach our destination. This whole time I have been trying to convince her to get checked out. At very least she lets me get her a wheelchair to ride it up to my grandpa's room. Finally, after seeing him for a bit, she agrees to go down to the Turns out she had pretty much destroyed her ankle. Wound up having surgery to put plates and pins in to fix the bone. That woman is amazing. TLDR. Mom shattered her ankle, insisted it was fine, undertook a 7-hour car ride, hobbled around on said ankle at stops, wound up having surgery to fix it. Not a medical professional, but since a lot of people are taking the patient's perspective, I figured I'd throw mine in as well. I don't get much benefit from pain medication, and apparently anesthesia, so I end up toughing it out, which may be okay, because I might have a high pain tolerance. A few things that have happened. Surgery at age 5. Woke up in the middle, and surprised/scared the staff. Dislocated shoulder at age 17 in bed. Went to the nurse's office, got ice on it. 2 hours later my dad picks me up. He takes me to the doctor to get it looked at, and instead of just getting a sling and X-ray, the doctor first asks why they didn't put it back in right away. Apparently when asked about it later, the nurse denied it was still out while in her office because he would have been in more pain. She never really checked, but I digress. Surgery at age 19. Afterwards I complain of pain. After repeated complaints, the nurse ends up maximuming out the pain medication drip, not sure what it was, and then a shot of Vicodin. At some point during the night she gave me a shot of morphine, and when I continued to complain that nothing was helping, she explained that she couldn't give me any more without a doctor's approval, who was going to be coming in a few hours. This was early morning, maybe 4:30ish, and to tough it out. At some point during the night she ended up removing my roommate who was unable to sleep due to my complaining. Sorry guy. At age 23 I spend all day in the sun in nothing but shorts. Dumb, I know. Back at the campfire, it's 85F. I'm next to the fire, and I'm shaking because I'm so cold. I get taken to the they check things over, give me 3 units of fluids, and send me home. Next morning I can hardly move. Ended up with severe, 2nd-degree burns. They kept calling it 2.5. Not sure if that's a technical term though. Over roughly 2/3 of my body. How they missed that in the I don't know. Ended up with a lot of therapy, pain, time in the whirlpool, ruined t-shirts and shorts, due to a lot of blisters popping every time I moved, and had a video done of my healing process to show in one of the local university's classes. The guy heading up the medical care was also a local professor. And everyone at the local clinic knew me as Burn Boy, because, as a nurse told me, they didn't use my name, so it didn't violate HIPAA. Side note, I use a lot of sunscreen these days. At age 24 I dislocated my other shoulder. Go to the they're busy so they stabilize me, but don't give me anything for the pain or even ask. Apparently I didn't look like I was in pain. Over 4 hours later they finally get back to me and decide to put me under to put it back in place. They start to inject some whitish liquid and ask me to count down from 100. Well, after I came to the doctor asked me if I drink alcohol a lot. I explained not really. He then told me I could drink most people under the table, and that someone for my size should normally take about 4 units of that white stuff to pass out, but that I took 12. Not sure what all that meant. At age 27 I had my wisdom teeth pulled. I woke up about 5 seconds into it, and was lucid for the whole thing. They saw I had opened my eyes, but they kept going anyway. The rough jerking of my head surprised me. I thought they'd be more gentle for some reason, and the sound. That sound will never leave me. Anyway, figured I'd share for anyone who wants to read a very long post. TLDR, I have some weird issues with pain medication/anesthesia drugs, and may want to make my pain more non-verbally apparent when in the hospital. I'm not an ear doctor, but last year I had to get a large amount of warts removed from my feet, and it essentially stretched all through the top pad of my left foot. The doctor who was removing them had to freeze them off using, and told me if the pain was too much to just tell her to stop. Now since this covered at least 60% of the pad, that meant there would be a lot of freezing going on, but I somehow didn't flinch until the end, when the pain started to kick in. Now if any of you have had plantar warts removed, you'll know that the area affected usually balloons up and gets all purple after a while, which causes a lot of pressure and pain. So I'd like you to imagine this. http www.visualfetus.com except covering the entire top pad of your left foot and much more ballooned up, and then imagine walking on it while having to break into a new pair of Sperry's because of school dress code. Surprisingly, I trooped through it and walked on it for over 6 weeks until it lost size and the skin began to tear apart and reveal the raw skin underneath. Another very nasty sight. It wasn't until a few months later that I found out most adults need some sort of anesthesia after the treatment, as some people have fainted with less than what was treated on me. There is actually still a pretty large scar there now, and I get little shocks of pain coming from there due to nerve damage every once in a while, but I'd say it's something I'm proud to have trooped through. When I was about 3 to 6 years old, I used to accompany my dad on his rounds at the hospital. Most of his patients were elderly and liked having a little kid come in for a surprise visit. One day I was sitting by the nurse's station waiting for him to wrap things up when a little boy about my age was brought in by his mom and stepfather. He had a massive gash on his forehead, like someone had smacked him with the claw end of a hammer, and there was blood caked all over his face and clothes. I distinctly remember seeing bones showing through under that blood point. I also remember just staring at him, open-mouthed, as he calmly came and sat down next to me on the bench to wait for someone who could come take a look at him. His parents were talking to the nurses, both very calm and matter of fact, stating that he had been playing and fell down some wooden steps in their house. The boy was totally clear-eyed, watching and listening to what was going on but with no emotion whatsoever. He couldn't have been more than 4 or 5 years old, but he just sat there like a battle-hardened Viking. Then my dad came out, took one look at him, and said, "Well, guess somebody ought to stitch you up." The boy just smiled and nodded, and went with my dad and his parents into one of the empty rooms. I followed and watched as my dad got out all his tools, something that damn near anyone, let alone a child, might find frightening, and got to work cleaning and numbing the wounded area. I think a general anesthesia was used, but I don't remember the details here, not a peep. The boy sat there while my dad sewed him up, looking like he was getting a foot massage. His parents were chatting with my dad, saying that he had always been a little trooper and rarely, if ever, cried. Afterward, my dad put a giant band-aid over the wound and gave the boy a little pack of gummy bears as a reward. The boy thanked him, and he and his folks left without a backward glance. To this day, a good 20 years later, my dad swears up and down that this little boy remains one of his toughest patients ever. I'm not a doctor, but I will share my pain story. When I was in high school, I tore every tendon in my right ankle playing basketball. I had a pretty sweet lime green cast on. Well, one night my mom and I were having a little BBQ when the light fluid bottle spilled all over my cast. My mom and I didn't think anything over and went about eating our meal. Fast forward a few hours later, when I'm watching Above the Rim on VH1. I'm sitting there when my leg in the cast begins to itch like crazy. The itching then becomes a slight burn. The slight burn turns into this incredible stabbing burn. So, I wake my mom up and tell her, "Hey, my leg feels like it's on fire." She tells me to put some baking powder down my cast and use a butter knife to push down the powder to where the burning feeling was at. I do this yet nothing happens. It worsens. Again, I wake my mom up and tell her how bad my leg is hurting, and finally, we're on our way to the hospital. By this time, the pain is agonizing and my blood pressure is through the roof. The RN rushes me into my bed, but is really struggling to get my cast off. RNs, I guess, aren't really trained on how to take off casts, and the whole time she's trying to saw it off and shaking my leg, and sharp pains are piercing through my entire leg. Luckily, my mom at the time was a medical assistant in sports medicine, told the RN to shut the curtain, and proceeded to cut my cast off. Then came the many bags of saline they poured on my leg. So nice. I ended up with 2nd-degree burns and 5 to 6 huge blisters on legs that are still scarred today. Worst pain in my life. This will get buried, but here I go anyway. I have been a chronic pain patient, 26F. For the past 9 years, suffering from CRPS following a routine surgery to correct clubfoot. I take 40 IH tablets a day plus ketamine. I also have a spinal cord stimulator implanted to help control the pain. Before this and with other things I would say my pain tolerance was pretty high, but CRPS is a whole other monster. Over the years, it has changed my pain scale. What I thought was a 10 5 years ago is now 5. Due to the CRPS, my bone density became quite bad, to the point where I risked fractures from weight bearing. The hypersensitivity from the CRPS was getting worse and worse, and I had spent the past 8 months in bed with absolutely zero quality of life. To save my foot would require 6 surgeries, which would only stabilize things, not do anything for pain. There was an 85% chance I would lose my foot, so I chose amputation from the start, so I could get on with recovery in my life. It was done on the 19th of August, nearly 3 weeks now. I was really worried about the pain, based on the fact I already took enough to kill a horse, so I had an epidural in for the first week. When that came out I had 3 days of morphine, and am now not taking anything other than the stuff I was previously. I have to be cleared by my surgeon and pain team at the 6-week point before I can start reduction. I'm amazed. I have had much simpler surgeries that have been far more problematic and painful. I, touch wood, have no CRPS symptoms in the stump and the bone pain from before is gone. My pain is at a 3-ish, but it is only that because of the shaking/twitching as my body gets used to the new setup. At the start of October I will be able to start reducing my medication, and whilst I'm not looking forward to withdrawal symptoms, my liver and kidneys will thank me. I also will be taking my first steps this coming Friday. One thing I will say is, as a chronic pain patient, especially a young one, accident and emergency/ER is the worst place. Unless you get someone who listens, they look at your file, assume drug addict. Last year I had a 15 cm x 8 cm cyst that had twisted my ovary twice. It took 4 hospital admissions, 20 plus GP visits over 2 months before they took a look and saw the problem. Soon as it was out I was home the next day, neither up nor down. I know hospitals deal with a lot of drug seekers, but it sucks to receive less than normal/decent treatment or no treatment whatsoever, because they assume that addiction and chronic pain are the same thing. Not her, but I'm a nurse. Recently I had a part in her 70s who was post-vulvectomy. When I received report I was thinking it's technically a void. How bad could this be? Oh my god. Oh my god. The nurses I work with are 90% assholes, so it was no surprise to me that when I introduced myself and assessed her, no one had given her pain medicine in 12 hours. Also, no one had completed her treatments in 2 days. Needless to say, my head turned 360 degrees and everyone now hates me. But shit, what assholes. I couldn't faking believe it. Her vagina, or I repeat what was left of her vagina, looked like a cross between a baseball glove and a Jamaican ugly fruit that extended down to her anus. Also, it required drains which extended to about 1/2 foot above the knee. These drains were supposed to be compressed and weren't. The dressings on the drains were saturated, and the douche nozzle put a depends brief on the lady because she didn't want to put her on a bedpan. When I took a good look, she had stool all over the surgical area and some small areas of separation along the suture lines that were welling up with pus. This lady was silent and pleasant. Literally zero complaints. One of the kindest patients I had. It took so much restraint to not get ghetto on my coworkers. I washed her up, pumped her with opiates, and called her document about the pus. Not only did that woman's bravery astound me, but I was floored when I realized that she hadn't been given her scheduled Q4H meds for 3 increments of time. I know I'm super late to this thread, and it probably isn't even worth it posting, but I'm going to anyway. I'm from Australia, and I traveled to the US for a basketball tour. Finished off 8-4 of 12 matches, not bad. After the tour had concluded, we decided that we would go snowmobiling up in the mountains of Washington state. At that time, around 2011, it hadn't snowed up in said mountains for over 6 months, meaning that the surface of the ground was icy at best. About 30 minutes into the drive up, I hit a hairpin turn a little too fast, and as a result the left ski of my snowmobile lifted up, meaning I couldn't keep turning, and I was heading straight for a thick row of Douglas firs standing in front of a ravine. In a situation like this, panic takes over quite quickly, and I squeezed the accelerator and hit said Douglases at about 100 km/h, 60 miles per hour. Thinking that I had done little to no damage, I jumped off the snowmobile and fell on some hard-packed snow, fracturing a couple of my back ribs soon after the rest of my group caught up to me and checked me out. I was lying in the snow dead quiet waiting for someone to find me, as I couldn't get up. I was unaware of injuries sustained until my dad pointed out that my left leg made a right angle about halfway down its length. Even though I was in unbearable amounts of pain, I didn't make noise or cry or scream. I went so far as to joke to my dad about the costs of a subsequent operation to fix my grossly compound tib/fib fractures and the 2 ribs after hearing that the helicopter would take a good hour to get to where we were on the mountain. We decided that I needed to get down to the base quicker, namely through the back of a snowmobile. To achieve this, I needed to stretch out my leg, pushing the bone back in, still not screaming, and then put on a rudimentary splint with broken tree branches and a couple belts. I then rode on the back of a snowmobile down the mountain with a compound fractured leg for 45 minutes. He drove slower, so it wouldn't be as bumpy, to a waiting ambulance who morphine dripped me up and sent me on my way. All in all, a terrible experience. Knocked out the lower portion of my front 2 right teeth doing a jump for curl or good. I literally jumped up and then seemed to have a bit of a disagreement between my feet as to who was going to land where, face planted onto concrete. This was mid-practice during a run-through of a chunk of our show, and I just laid in a ball on the ground, in what I presume was shock, but felt like embarrassment. Few moments later, both my coaches and my entire team and a few parents had swarmed me. Meanwhile, I'm wiggling my ankles, then knees, working my way up my body to check for breaks. Tasted blood, figured I'd broke my nose. Look around the floor, see 2 white dots, notice it hurts to breathe in and out, point and say hand me teeth, point not a single tear shed, and I'd find out later, after I drive myself to my awesome dentist who came in at 10 PM to see me for free no less, that I'd cracked the root to both. We had a competition the next day, so he came in on a Saturday at 6:30 am to put my teeth back on and get me ready to go for this competition. The whole time, I was more concerned about if I could compete or not the next / that day than my teeth not being in my mouth point. When he finally figured out what was wrong, the root cracked bit, he looked astonished and asked how I wasn't crying. I just shrugged and told him it didn't hurt that bad. Point my pride on the other hand, that hurt. Not a doc or nurse, but I was just in the and have a related story. Point the middle of last week, I had just eaten lunch when I felt a sharp pain in my back. It quickly moved to my abdomen, shoulder blades, and chest. Then I couldn't breathe. My entire torso felt like it was trying to implode on itself. So I called 911 and wheezed out my problem. Point fast forward 25 minutes. The EMTs arrive and wheel me out to the ambulance. The first thing I notice is that the guy who is taking point on this is clearly a newbie. He's pretty calm and collected, but he's making a lot of little mistakes because the other guys keep correcting him. They give me some things to reduce the pain and whatnot, so now I'm starting to think a bit more clearly. I wish they hadn't, because it was now 4th time, and I'm terrified of needles. The new guy's trying really hard to find a vein in my left hand, but can't do it. So he moves to my left inner elbow. The old guy yells at him and says try the other hand first. He finds a vein and sticks me with the infernal needle. At this point I about passed out, not so much from pain, but knowing that I'll have a needle in my hand for a few solid hours. Fast forward another 20 minutes. I've been at the hospital for a little while now, and after an EKG they immediately did blood work. More needles, 3 to be exact, and guess what? This nurse was new too. Jump ahead 4 hours now. They've tested me for all sorts of things, and the pain is mostly gone. Turns out I have some nasty gallstones, and when my gallbladder tried to open the bile ducts, the stones clogged it. Apparently the pain associated with this is on par with a heart attack. I'm feeling up to getting myself home at this point, so the nurse helps me to remove all the little EKG and heart monitor stickers. Let me just preface this by saying I'm a hairy dude, like really hairy. The little stickers from the ear weren't too bad, but the ones the EMTs put on me were stuck on with Gorilla Glue, I think. Then came the worst part. The 4th. When I tell you that it took 2 male nurses to get the protective sticky pad off. I'm not joking. The main nurse pulled on the pad while the other helped me hold my hand down. I now have a background bald patch on my hand and the needle hadn't even come out yet. The pain from that sticky bastard was honestly worse than the gallstones. The nurses told me they've seen full-grown men, which I guess technically I'm now, brought to tears taking those things off. Not a medical person, but was told afterwards by my doc he couldn't believe what happened. I was 17 at the time and was out in the deep backcountry with a couple friends. We were hiking and fishing and generally having a good old boy kind of time. We finish up, get back to the car, I get in the back seat. The driver door was still open and I ended up grabbing the metal piece that divides the doors. My friend slammed the driver's door closed, pinning 3 fingers in the door, completely fracturing 2 of them, bone sticking out, and severing the tip off my ring finger. But the pinky, that was the crazy one. The door squished it just right so that all the meat in the finger squirted out the end. Think a hot dog all flopping around with the insides all coming out one end point. When he opened the door, at first it didn't really hurt, just kind of throbbed. I looked at my hand and totally had a stunned and a moment as blood was shooting, or more like spraying, out of my fingers. We were out of cell range, so we just duct taped it and drove back into town, which was too small for a real hospital, but the town doc had been a surgeon and still did outpatient stuff sometimes. So get to the docs, and him and the nurse, who happened to be my mom, rush me to the back and immobilize my hand. He starts injecting me with a local anesthesia, and that's when I learned immune to a bunch of them. So he tries a couple different ones, none of them works, so he basically just had to say fuck it and started operating. Opened up the pinky, put the meat back in the right way, sewed it up, reattached the end of my ring finger, and splint up the rest, all without any pain relief. I'll admit, I almost passed out a couple times from the pain, mostly from the pinky surgery part. Edit, I can words good. Like a few others have commented, I and my father are basically immune to a number of painkillers, especially those used in dentistry. He once had 4 root canals done consecutively, where he could feel everything. He's also stepped on one of those big 6-inch cattle fence nails, went right through his foot. He just had my sister pull it out and bandaged it up without so much as a grunt. Didn't go to the hospital because he was pretty sure he'd had a tetanus shot sometime in the previous 10 years. As for me, I've had some fun stuff happen. A few months ago I had a spinal tap and my doctor told me I handled it the best of anyone he's seen. Similar story for the multiple bone marrow aspirations I've had. Big needle crunches through your hip bone and sucks stuff out, and you can feel it happening. Excruciating but pretty fascinating. In any case, I pride myself on not making a noise during them. Again, similar to another story, I sprained my ankle playing volleyball and kept playing, and didn't go to the hospital. Big mistake. The blood all pulled up inside my skin and hardened and took like 6 months to go away completely. Over 2 years before it was back to normal, although I think it's still a bit less flexible. Other things were not so great. I received a bone marrow transplant and was fine till the end, when I inexplicably had incredible abdominal pain. I guess my body decided that extreme agony was the best way to rebel against the invading stem cells. It was so bad I threw up from the pain. Prior to that, the greatest pain I had was a kidney infection, fortunately brief, and when my veins collapsed after having a Hickman catheter inserted into my chest/neck. Me, not a doc. Got an awkward hit on the soccer pitch. I went down immediately knowing this wasn't a normal bruise. I stayed still with incredible pain. My keeper eventually walked off the field to stop the game. Got picked up by the ambulance with excruciating pain. My kneecap was visibly, not compound, in separate pieces. When they got me on the cart and leveled my leg, the pieces fell back into place, lucky, and the pain was gone. Her radiology was rough until she went through the first set of x-rays, then she apologized. I think she was whiter, she was black, than me. I'm pale as hell. In other words, my fracture and what she did to me scared the crap out of her. To the gist of it. About 4 hours after being brought into the ER, I needed to use the bathroom. The nurse brought me a bedpan, Tupperware container looking thing. I asked my buddy in the next bed if I could use his crutches. He agreed. I did have the ambulance splint on my leg. I went towards the bathroom. A nurse, not mine, said okay there Ambo. To which I took as him hitting on me. He might have been. FYI I'm a guy. When I came out of the bathroom my nurse found me and said what that hell? You can't get out of bed. I'll hold you until we get a bed. I'm fine. I really had to piss. Later. In the evening the guy nurse who I think liked me showed me my x-ray. No one had shown me what was truly wrong. I was on the crutches for the second time then. He said something like, you might be cute but you're dumb. You shouldn't be moving right now. The morning after my pathominimization, I wanted to kill myself. I have never felt pain like that. After crying to the surgeon on the phone he said, you're a big guy, take more until you don't feel the pain. Me, what's the limit before I overdose? Him, don't take that much. 4. The removal of the hardware I seeked out a different doc. TLDR, broke kneecap in half, grabbed someone else's crutches in her to go take a piss. This story is semi-related. I would say that I have a pretty high tolerance to pain, but probably because I have a high tolerance to medicine, and usually it has a poor effect on me. When I went to get my wisdom teeth removed I was set on declining the anesthesia because I have a fear of being medically put to sleep. My mom and dad made me promise to use it, so I didn't fight it. When I got there they put the laughing gas over my mouth and waited for it to take effect. After about 15 minutes I was still fully awake. They then huked up and forth with Valium to me. They waited and waited and waited, and I was still fully awake and alert. I was even texting my mother who is a doctor and she informed me that she has no idea why I'm still awake, because that was enough to knock anyone she knows out cold. Finally the doctor comes in with 3 shots. He whispers to me alright it's sleepy time. He gives me the first one. Nothing. Waits a minute and gives me the second. Still nothing. Finally he gives me the last and says the room should start to spin. It does. And finally I'm out good. When I wake up they try to help me walk to a chair, but I politely decline and walk to the waiting area. As I start to walk out they force me to sit in a wheelchair because it was policy. I left that office in a wheelchair extremely pissed because I thought it was embarrassing. I'm not a doctor or a nurse, but I think one experience I had will suffice. This was actually while the doctor was administering a local anesthetic. Grade 4. I smashed my face because I ran into a pole. I'm a huge klutz and chipped a tooth. Upper half was fine, so they just put a crown on it. Never had a problem with it for a long time. Last year, 20 years old, I noticed some swelling above said tooth. I went to the dentist to get it checked out. Turns out I had an infection, and it was a dental abscess. Antibiotics for a week. No change. Go back and they give me more. A few days later I'm in a lot of pain and there is still no change. So I go to the The doctor gives me Tylenol 3s for the pain and tells me to go to an emergency dental clinic in one of the bigger hospitals the next day. By this point my mouth is swollen as fuck. So I get to the clinic and the doctor says she will have to numb me and make an incision in my gum to drain the fluid. Oh, I should mention the dentist drilled holes in both of my teeth, one with the crown and the one beside it. Turns out the nerve was damaged when face med pole. Also I was told the nerves in both of these teeth had died, hence the buildup of decaying fluids above my teeth. The holes just weren't helping it to drain enough. When you have swelling local anesthetic doesn't work as well as normal, so I needed 2 needles instead of just 1. I have no issue with needles, but I dislike getting them in my mouth. I can't remember if she had told me it was going to hurt, but it did. A lot. Worst pain I have ever experienced. I honestly don't know how I didn't kick this doctor in the face. I don't even know how I stayed in the chair. I started bawling my eyes out. If I hadn't had her hands in my mouth I probably would have been screaming. At one point a tiny noise came out, and that was the closest I could get to a scream. I would not wish that on my worst enemy. The infection was so bad I lost some of the bone in my upper jaw. After they drained it, I was on 4th antibiotics for a few days, and then back to pills. The 2 root canals were not even painful compared to what I had experienced with the needles. TLDR, had a huge dental abscess from an infection. 2 needles for local anesthetic to drain the fluids. Worst pain imaginable. Pop went a month with blinding headaches, extreme nausea, and near the end of it minor hallucinations. Spent a week in the hospital, got released for another month. Came back when he was non-functional as an autonomous adult, and it turned out he had a double hematoma. Basically he hit his head on 2 separate occasions and was bleeding copiously into his cranial cavity. His brain had been squished into a pita shape. Basically his brain was at a little less than half the volume it ought to be due to internal pressure and time, causing intense pain, and auditory hallucinations factor in his pain meds, and he was having visual hallucinations as well. My pop, being an old damn hippie, generally shrugged them off, even when we were sitting with him, and he startled and told us that his breakfast applesauce was now cockroaches. A second or two later he just kept eating them. He even joked with us about how at least he didn't feel the crunch. When they finally got him into surgery he opted to stay awake for it. So trepanning. Neat, right? Basically a modern version of that. They took a drill, opened the front of his skull, near the temple, stuck a real tiny vacuum hose in, and sucked out the clotted blood. While he was awake and fully coherent. The closest thing he said to complaining after was, "Next time I'll opt for the drugs," while rubbing his skull hole. As a patient, I herniated a disc in my back and asked my doctor for an MRI. He denied me at first since he said, and I quote, "You don't seem like you are in enough pain to warrant that. I would expect it to be a lot worse if that was the issue." He was a fantastic doctor and I don't blame him. I walked in there and spoke even-toned. I would have thought the same thing. I just for some reason can't show pain in front of people. I don't do it on purpose and I don't know why I do it. It is simply the way I am. Anyhow, this was a Friday, and I eventually convinced him to order me an MRI. He ordered one for the following Monday morning. I suffered unimaginable pain over that weekend. I actually never slept that weekend, because the only way I could be without pain was curled into a ball while sitting upright in a chair. Anyhow, I took the MRI that Monday morning, and that evening I got a call from my doctor telling me to go to the emergency room straight away. I walked into the ER as normal as can be. When I met the ER doctor, he looked at my MRI and said he could not believe that I walked in there. He said, literally, it looked like my disc exploded. I spent the night in the hospital, and they had to drug-induce sleep for me. They had to pump sedatives into me every 2 hours. The next morning, Tuesday, I was taken in for surgery. It was a crazy 5 days I will never forget. I have had a baby and had emergency C-section. Labor with no epidural was only a fraction of the pain I felt with that disc. By the way, I didn't believe I was in labor during my contractions because I didn't think it hurt enough. I actually thought I was constipated for the first few hours and just kept trying to poop. Then I thought it was Braxton Hicks contractions. Finally, I realized I was in labor and arrived at the hospital at 9.5 centimeters. The nurses were in shock. They thought it was not real labor at first either. I broke my 3rd toe at a Christmas party when I was 11. I was walking to my table when my cousin suddenly scooted out her chair and sat in it while I was coming up behind her. My toe collided with the chair. I was walking relatively fast, don't know why, and the pain was immediate, not too severe. Felt like a bad stubbed toe. Anyways, I sit down on the couch and I know it's broken. I tell my mom and rest of family. While it is swollen and black and blue, nobody believes me because I'm not crying. That night my 88-year-old granny put her tincture on it to make it heal up. She's cute. Her tincture was turpentine. Lol. Fast forward a month, and I'm still feeling some pain when I go upstairs, and I ask my mom if she will take me to the doctor. They x-ray it, and it turns out to be totally broken. The x-ray techs told me that they thought I would need surgery. Nope. Since I wasn't taken in until a while after the incident, there was nothing they could do but make me wear a hideous boot. Another time I was ziplining for the first time, and it's the first line of 5. Well, I like an idiot am enjoying the scenery so much that I don't lift both my feet high enough upon reaching the other stand, and my left foot hits the thing and breaks. It wasn't bad until I landed, but then I did feel like I was going to pass out. My sister starts laughing when I ask the guide for a drink of water, which they don't have. I finished the rest of the lines. My sister paid for the trip, so I didn't want to waste her money and actually had fun despite the foot thing. Sister does not believe it's broken. It really was. Did not get to doctor in time. Got stuck in boot again. TLDR. Broken bones. Nobody believes. Suffer in silence. Edit. Spelling. Autocorrect. Playing rugby at uni. Went in for a tackle all wrong and hurt my shoulder. Couldn't move it and had to walk off the pitch thinking it would start working again. It didn't, but I thought it was only temporary, so got changed and went to the pub with the boys for a few beers and a pub quiz. Anyway, next day still can't move my arm, so go to the chemist and ask them what it might be. They have no clue and tell me to go to the doctor. Do that the next day and he says I've dislocated my shoulder and should really go to hospital. I was due at my parents that weekend, so drove home from uni to my parents, about 150 miles away, where my mum, a nurse, confirms I've dislocated my shoulder. I didn't want to miss too much uni, so I drove back at the end of the weekend and went to hospital, where I had to fess up that I'd had a dislocated shoulder for about a week. After a lot of pulling and tugging, they got my shoulder back in. They were talking about an operation as it had been out for so long, but they got it back in and said it should be go to go, but to be careful. I walked out of the hospital, tripped getting into the cab and dislocated my shoulder again. I wasn't sure at the time as I had painkillers and a sling, but was confirmed at my checkup a few days later when they did get it back in again. Over the following 4 years I think I dislocated it another 4 or 5 times. I've lost count. But twice snowboarding, once volleyball, once on a boat, on a bus in various different countries. Eventually did get around to having the operation to put it all back together, and it's been good ever since. In retrospect I was in a lot of pain, but I'd heard dislocated shoulders hurt a lot, and I figured I could take more pain than I currently had, so it couldn't be that bad. The beer and then subsequent numbing of the pain obviously helped. Pharmacist here. When working in the ER during my clinical rotations, we had a gentleman come in with severe swelling of his tongue. By the time we joined in, there were already 2 ER doctors attempting to place an nasopharyngeal tube in an effort to maintain an open airway just in case this guy's already massive tongue continued to swell and closed off his airway. However, the gentleman happened to still be quite awake and actively resisting any efforts to insert the tube, complaining that it was causing significant discomfort. The docs were literally lathering the already smaller than average tubes with both Kai and lidocaine jelly, but this guy still complained of pain. At this point it is quite clear that there is something off about this particular man. He was already receiving a small amount of anti-anxiety and analgesic medication that seemed to have little to no impact on his state of mind. Even when nearly doubling his drip rate on a particularly effective anti-anxiety med, he was still practically throwing the docs around. Fast forward a few more minutes of trial and error tube placement, the docs finally get a tube inside the nasal passage and begin to move it gently toward the rear portion closer to the throat. Unfortunately the man, still being awake, proceeded to sneeze, sending blood from the nose, which was now flowing rather nicely, and Kai mixed with nasal secretions in random directions, splattering docs, nurses, and pharmacists alike. Even worse, in his sneezing and nearly constant combat with medical staff, the nasal tube must have made contact with his throat, leading him to vomit, likely in response to a gag reflex. At this point 3 different types of fluids are now exiting this man's nose at sometimes rapid velocities, and this whole event becomes nearly the nastiest wrangling in my training. Things settled down significantly once we initiated a proper full drip that, even at the maximum allowable rate according to the machine, still allowed fore and toe movement to occur. Once things return to normal, a more complete history for the patient appears. Firstly, he was clearly a drug abuser, as even clinically high doses of incredibly potent medications resulted in minor, if any, sedation or pain relief. The patient was not only abusing prescription pain medications on a daily basis, he had also been crushing stimulants and snorting them, resulting in a severely weakened and thinned mucosa lining that had seemingly resulted in the patient having an overly sensitive nasal lining. And it was a good thing the docs placed that tube, because within 12 hours his throat had swelled to encompass the entire area around the tube. Patient, not doctor. When I was 18 I had to go through multiple surgeries to fight against a deep tissue sarcoma on my right hand, hyperthyroid. That'd be the edge you use when doing a mix of karate wood cutting. First one was an isolated limb perfusion, where I'd have my right arm totally irradiated by very high doses, of Chima products. To the point that my arm was like heavily sunburned from the inside, and it needed to be slathered by 500 milliliters of biofine every couple hours for a week. And had 24 hours of 41°C plus fever after the surgery. A good tip I learned: if you have very high fever, put a bag of ice in a towel on your femoral arteries. Helps a lot with your body temperature. After post-op treatments, I had a fourth perfusion of morphine at my disposal, and never used it, because I didn't know I could push the button that often. When the nurses came and saw the pump barely change they asked why, and were quite astonished that I didn't use it. Obviously, being 18-year-old at that time. I pushed the sheet out of the pump for the next couple of days, and got high on medicinal morphine for the lull. Same thing happened after my last surgery. Left forearm shred graft, not sure about the English for that. Graft of tissues plus muscle plus nerve to repair my right hand. Obviously I also had morphine pump, barely used it, and astonished the nurses every time I answered their pain question by who I don't know. 4. 5. I've been told I have a decent pain threshold by doctors, though I'm probably a bit late to the party. I was playing basketball, jumped up for a layup and this kid barreled into my stomach, taking the wind out of me. I land on the side of my foot, something cracks and my foot bends badly. I limp to a bench and stay there for a few minutes until I catch my breath again. Then my marathon begins. I walk to the changing rooms in the other sports center, 50 meters away. Up the stairs, grab my school bag with every school book I needed for GCSEs, textbooks and workbooks, around 30 books total, and gym bag. Walk halfway to my house, around a 10-minute walk, uphill, in pain but nothing too bad. I think I've just twisted my ankle at this point. Halfway home, I realize I won't be able to make it. My ankle's swollen to the point where it doesn't fit into my shoe anymore. I call my mum to come pick me up. She does, sees my ankle and takes me straight to hospital. I'd rate the pain at around a 3 at this point. Get to hospital. Put through to minors of AE with a 5 to 6 hour wait time. Sure. Eventually I see a doctor who insisted on x-rays. I've never broken a bone in my body and thought that it didn't seem so bad if it was a broken bone. Turns out that I'd torn the 3 ligaments down the outside of my ankle. Oops. There was also the time where I had quinsy on both sides and was misdiagnosed for 6 months. To the point where I couldn't eat because apparently I didn't make as much of a fuss as people with quinsy usually do. I have some sort of intolerance to narcotics/opiates as they make me violently ill, as in persistent projectile vomiting. Antiemetics don't seem to make much difference. For me opiates equals massive amount of barfing that goes on and on. Around 2000, I decided that I should take a wait-see approach to serious pain meds. Since then I've herniated 2 discs, a couple major back strains, and have had 2 surgeries, 1 dental, 1 abdominal. The only pain meds I've used have been the OTC ones at my pre-surgery consultations with my surgeon and my anesthesiologist. I told them about my intolerance to narcotics and they agreed not to give me any without my expressed permission. They loaded me up on antiemetics and there was a standing order for Tomerol, SP, if needed post-surgery, if needed. Anyway, I did fine with other surgeries even with just Tylenol. Yes, it hurt. At the worst, I'd put it at a 5 or 6 on the pain scale. For the abdominal surgery, I was in surgery for 4 hours, out of recovery by 2, and was able to get out of bed by supper, walking loops around the ward around 2 in the morning. The nurses said they had never had a patient recover so fast. Excuse me while I preen a little. I've come to the conclusion that I can actually handle a good deal of pain if I can keep my wits about me. It probably helps that I'm a pretty calm person by nature. Not a doctor or nurse or anything, but I've got a story worth telling. I was doing farm work in Australia and living in a working hostel while at it. In my dorm, there was this girl who, for lack of a better term, had a very low tolerance to pain. I'm talking about exclaiming I need medical attention when she had a bad hangover. That and when she got a small tattoo symbolizing friendship with a few other girls. She spent ages trying to find a spot where it would hurt too bad. I would make fun of the fact that she had a tendency to overreact in situations like this, but it was always in jest, not meaning anything. Anyway, one of big toenails got infected, and she was doing everything in her power to not have it removed. She said the toenail has had to be removed before, and the pain was really intense for her. Yeah, I believed her. Unfortunately for her, she lost that battle and had to have the toenail removed. Now, the following is second-hand information, but from what I've been told by people who were there, she literally screamed the whole hospital down as they removed the toenail, passed out from the pain, and that was with a ketamine injection beforehand. She was pretty amusing when she came back, whacked out of her mind on the ketamine and a big bandage on her foot. I felt really bad for her though. Meanwhile, it was probably the wettest week I've ever worked. I worked on a banana farm in Queensland as someone who hung/debagged the bananas. When they came in for processing, the water from the bags got over all me and into my boots, and given it was my second last week, I got a bit neglectful about changing my socks at breaks. As a result, I myself got trench-footed almost the same time this girl got her toenail removed. Walking with trench foot is painful to say the least, and I ended up getting it pretty bad. On the Thursday, both me and the girl were confined to our beds and neither of us could really walk. For trench foot, one of recommended treatments, apart from resting the feet as much as possible, is to spray some white spirits on the affected areas. The Thursday when I got this, I went looking for some in the hostel, found some and let a friend spray on it. Now, FYI, I too have a low pain threshold. It was the main reason I couldn't carry, or hump as it was called, bananas in the field as the heat out there got to me more than others. For example, when these people spray the white spirits on my trench foot, I screamed a lot. Next day, the fact that I reacted so badly to the spray had gotten around the hostel and back to the girl without the toenail. I was reluctant to do the same thing that night, but for the sake of healing, I had to, and I might as well as give the girl a much needed laugh by doing it in front of her this time. Yeah, bad idea. She herself took the spray, and I sat down a chair and braced myself as much as possible. She sprayed, I screamed, she sprayed, I screamed again. Then she got sadist and started spraying way more white spirits than what was needed, all while I was screaming like God knows what. She even started laughing as she did it. She eventually relented and me, close to crying from pain, muttered out a thank you and limped back to my bed to lie down for a bit. She had a chance to get me back for all the times I made fun of her overdramatic reaction to things and took it with both hands. I laugh about it now, and even though we've gone out separate ways, I still talk to her on Facebook every 2-3 weeks, sometimes reminding her about her toenail, though mostly not. I might end up meeting her again in November, but knows what might happen. TLDR, a girl and me have low pain thresholds and overreact completely when our feet got messed up. I had a dog nearly 7 my left, dominant, thumb back in March 6:30 p.m. We head to the local smaller, they can't do much with me, except find someone at that late hour to take me. Cue the morphine. Morphine wires me up. It turns out, I can't sit. Can't lay down. I'm just a walking, talking fool. First hospital they call for a referral. Oxford, Mississippi, says send him home with painkillers. We'll schedule an appointment in a few days. The middle bone in my thumb was in 3 pieces. The doc, I loved that man, said thank you and hung up. He called Jackson Manuscript, his alma mater, and talked to a few folks that he knew, and ended up sending me there. I got more morphine for the road, and my wife drove us there, about 2.5 hours away. At the Jackson about 1:30 a.m. now. The nurse was a combat medic in the army, and she just shook her head. I was still wired, awake, and waiting for the surgeon to arrive and come up with a plan. More morphine, yay. They finally got me into a room, and about 6 o'clock the next morning, I dozed off for a few hours before they wheeled me off to water put my thumb back together. Every follow-up visit I had with the doc, a plastic surgeon, he told whomever was with him that day, teaching hospital, about how he first met me in hanging out laughing and joking. carrying on with everyone, while my thumb was hanging on for dear life. After reading through this thread, this isn't really that bad, but I feel like I need to put it out there. I worked at a grocery store in the dairy department with another guy named John. John was a little older than me, probably 30, and fairly reserved. He had a speech impediment, so I assume that's why we had to move these large milk boxes, racks, that each held something like 80 gallons of milk or possibly more. They were heavy and on wheels, and we had quite a few in the back. One day he was moving one, and as they tend to move a bit on their own, he didn't realize it was coming in contact with another rack. His index finger went right between both of these boys and was completely squashed. He ended up with this huge gash from his fingertip and right down the center of his finger. It was so bad that we could see white/yellow fat protruding from the wound. It might have just been flesh, but it was bad. It was clearly a bad injury, but he was so quiet he wouldn't tell anyone. He showed me, and I took off running. By the time the manager and I got back to him, he had the wound duct taped up and said he'd like to finish his shift before going to the hospital. They finally convinced him he needed to go as his finger wasn't worth losing, and he went. Said it didn't hurt at all, even with exposed flesh/fat/bone. I think he was close to degloving his finger. I can't imagine taking the duct tape off at the hospital. Fact. I'm not a doctor, but my dad probably has the highest pain tolerance of anyone I know. I have two different stories, my first being about how I got in a fist fight with my dad one day. Let me start off by saying that my father and I have a great relationship. We get along great and all, we just sometimes get really pissed off at each other about dumb shit like political views and why the Dark Ages were called the Dark Ages. So one day my sister started a fire on my porch because she's dumb, I don't know, and he tried to blame it on my friend Jason, who he didn't really care for at the time, but both of my parents love him like their own child now. So he's sitting here bitching at me about how he thinks it was Jason, and I'm telling him I saw my sister do it. After a while of him going on about how I don't know what I'm talking about, I call him out for just not liking Jason. That just made it worse, and we start telling at each other. We don't get mad easily, but when we do get mad, we get really mad. I'm guessing I got it from my dad, but I'm working on it. Eventually he says, I see that you wanna hit me, don't you? I'm just thinking, fuck yeah, I wanna hit you as whole. I don't say anything though. He keeps taunting me saying, you won't hit me. I know you want to, but you won't do it. After about the 4th or 5th time he says it, I just decide, fuck it. I'm a pretty big guy at the time. I was 16, about 6 feet 2 and 270 pounds. So I braced myself to punch my dad, and yes, I know how to throw a punch. So I punch my dad, who is 5 feet 10 and maybe 230 pounds, right in the jaw as hard as I could. I'm thinking, fuck yeah, that'll teach him to challenge me. I see my punch connect with his jaw and he literally doesn't move at all. It was like my dad was Stonewall Jackson. So I'm just looking at him like shit, I'm faked. I didn't plan for this to happen. I thought this would work out better. He just looks at me and starts laughing. I'm not overconfident in myself. I've hit other people half as hard, and they have cried or bruised, or just showed some sort of emotion, but I don't know what I expected, because when I was 14 something much crazier happened. So, when I was 14 I worked with my dad during the summer. So one day at work I'm putting up some crown mold while my dad is cutting closet rods to hang clothes on. All of a sudden I hear a huge explosion, and I honestly don't think much about it, since my dad didn't call my name or anything. But about a minute later my dad walks in the room and is just like, how much longer till you're done with that crown mold? I don't even look at him, and I answer 10 to 15 minutes maybe. He just says, okay, that's fine, tell me when you're done, we need to go to the hospital. That's when I look down at him and see that the explosion was the grinder he was using, and that there are large pieces of the grinder and the actual stone that grinds lodged deep in his chest. That's when I freak out. I'm like, Dad, what happened? Are you okay? He just says, yeah, the grinder blew up, and I guess I'm probably gonna need stitches. So then he drives us to the hospital, but not before stopping and going through the Arby's drive-thru to get a beef and cheddar and a Jamacha shake. He got rushed into emergency surgery, where they told him with how deep the shards were he should be in shock and definitely not conscious. He got really cool scars though. Well, my year was first. I was playing The Floor is Lava with my little brother at my grandparents' House when I was about 7 or 8. I missed a jump and ended up falling head first and hitting my head at just the right angle to catch a staple in my granddad's chair that had come undone. I went to my mom and she looked at it. It wasn't bleeding or hurting, and apparently my mom didn't look well enough. She told me to go lay down and rest and she would bring me a snack. I got a pillow and laid down on the couch in the living room. A few minutes later, I noticed my pillow was really warm and wet. I looked down to see the entire thing soaked in blood. I carried the pillow into the kitchen, held it up and said, "Mama, something is wrong." She immediately freaked and grabbed me to look again. Blood was pouring from my head and my ear had separated and was only held on by the bottom part of my earlobe. She called my dad and got my grandparents who were on the porch, and we booked it to the hospital. They said I never cried and lost a lot of blood. I sat still as they x-rayed, and they sewed my ear back on point now, onto my nose. I was about 10 or 11. I was at my uncle's house about to jump in the pool. He had just built a new deck for the pool and hadn't gotten around to cutting off the overhanging wood. I figured I would try a backflip into the pool. I stood on the edge and jumped. Well, I did my backflip, but I was too close to the deck. As I turned, I caught the deck with just my nose. I hit the bridge of my nose, and as I kept moving it actually snagged the area where the bulb of my nose is, ripping it off. I didn't realize and thing was wrong until I came up afterwards. Then I felt my nose on my lip. It was hanging by a little flap of cartilage and skin on the left side. I got out and ran into the house holding my towel over my nose. I found my dad first and told him we needed to go to the hospital. When he asked why, I just moved the towel. I was pouring blood. He went pale and started yelling for help. My mom, aunt, and uncle came running along with my cousins. They took one look at me and my mom freaked. My uncle started asking questions and my aunt sat down hard on the floor and looked sick. My cousins could only say cool and asked if they could touch it. Went straight to the hospital and again sat still and watched as they sewed my nose back on point. I lost a ton of blood both times. I didn't freak out. I didn't feel any pain. The next few days sucked though. They hurt like hell then. Chef points. Since I started out in a kitchen, I was always trained that pain had no place in a kitchen. Without getting into my personal experiences, which there are plenty, I can say that I've had the pleasure of meeting people on both ends of the spectrum in terms of pain tolerance. Points. Dishwashers. Super awesome guys with skin made of asbestos. I can recall 2 or 3 that stood out. First one was a small guy, 40 plus years old, and ran the dish room. One day the internal temp control shorted out and was heating dishes upwards of 150 F with steam upwards of 200 F. Guy was stacking and carrying dishes, barehanded, all day while getting hit in the face with steam. Since our dish room is separate from kitchen, the rest of the bod didn't notice he had 1st and 2nd degree burns on his face and arms until we went back there to help with catch up. He was cool as a cucumber and only asked for a beer and a ride to the ER at the end of his 14-hour shift. Second was an older woman in charge of our sink area. Golden rule in the kitchen is that you clean your own blades, which someone didn't follow. She reached in and grabbed a heavy mixing bowl filled with scalding hot water, and her fingers got pinched between a 40 pounds mixing bowl filled with water and a 8-inch chef's knife, which sliced her middle, ring, and pinky fingers to the bone. The weight of the bowl crashed down on her hand and dislocated her ring and pinky finger. She calmly went to the wash sink, washed her hands, and wrapped her fingers up with duct tape, put on her 2 gloves, and wrapped that up as well, then tried to go back to work. Boss man had to carry her outside and tell her that she was going to the hospital. She came back the next day, apologized, even though it wasn't her fault, and did her shift. Line cook's ovens. Guy in the middle of service was hauling us getting food in / out of a 500 F oven when his foot got caught on something as he was twisting to get food out of the oven, which snapped his ankle like a goddamn toothpick on his 5th hour in a 16-hour shift. He went outside for a smoke, came back in, and finished his shift. Drove him to the ER afterwards. They set the broken bone and asked if he wanted pain meds. He said, "I have better stuff at home," and laughed them off. Guy was making a batch of demi-glace after dishwashers cleaned the fryers beside the range. 15-gallon stock pot boiling hot with demi. Saute and ovens guy lift the cauldron of goodness. Saute guy loses his footing, dousing him with sauce. 3rd degree burns on his hands and 2nd degree burns on his torso, lower forearm and leg. He washed his hands and arm in the sink, then calmly went to the deep freeze walk-in and changed clothes. He cleaned up the floor, then he did another hour and a half into his shift before a replacement could come in and cover him. Our exec pretty much forced him to go to the and drove him over to the hospital. Boss man said the nurses loved him, but I think that's cause he was lathered in meat heaven goodness sauce. Another Saute guy, and my personal hero, older gent, and recovering druggie. After hauling us right after a 80+ hour work week, he goes upstairs to the office to get some to-go boxes for service. Faking has a heart attack coming down the stairs and breaks his hip and left leg in the fall. He goes to the bar and grabs a stool, carries it to his station, sits down and waits for a ticket. We called an ambulance while he's doing this stool thing while we are trying to get him outside out of the heat. I help this guy outside and we both smoke a cig while we wait for the ambulance to park. He then goes, "Are you sure you don't want me to do this shift? I can do it if you trust me, man." My heart sank because I've been in that position, but I wanted him to get help. We are still good friends. He came in 3 weeks after he was given the okay from the docs and went back to working 70+ hours a week for another year until he retired gracefully. The man was a monster in a kitchen. Pantry girl was pulling focaccia the baker put in the oven for service out to cool. She was about 5'3" feet, and the baker used the top racks for his bread. As it turns out, he used a lot of oil, and when she pulled them out, excess oil spilled out of the tray all over her face, boobs and arms. Her face and boobs weren't bad. Chef's coat saved the boobies. Her arms had 1st and 2nd degree burns. She went to the freezer walk-in with our boss, where he cleaned the area, sprayed it with burn treatment stuff, gauze, and wrap. She was making jokes the whole time, then spent the rest of the day making fun of the new guy, the baker, and the baker's mom. I went with her to the hospital afterwards. She turned down pain meds and smoked a bowl once she got home. I had 2 women on the other end of the spectrum, both on the same day, 4th of July, busy. Both of them were just trying to get disability pay, but their pain was right on the money. First woman with years of homegrown skills was prepping for salads and desserts. I spent a week with her before this day basically reteaching her on basic knife skills. She could understand the basic concept on how to hold a knife, nor the safe way to cut. She came a long way, but she would also go back to her old dangerous ways, holding knife where there is no blade control, holding food to be cut with all digits out, etc. Anyway, she's obviously going through withdrawals from something, so her hands were very shaky. 0.15 minutes before service, I peek my head out and see her purposely sever a part of her index finger. She bawled and screamed for the chef to get her a medical charge paper so she could go to the crying, wailing, thrashing around, room of sharp, hot, dangerous things. No bueno. He takes her to the hospital, and he told me the second the doctor put the pain meds in her hands, she calmed down and then asked about disability pay. Pretty much, her pain was real until she could get her fix, which minus a digit, she got. I had to clean up all the blood the beach sprayed around. Then I had to finish her shift after just finishing mine. Good times. And lastly, new server first day, said she was happy to start. 0.3 hour into a dead night, she comes into the kitchen and grabs an empty keg and sat down and starts crying out of nowhere. Then she starts screaming, grabbing her knee. When I went down to ask her what's wrong, she said she can stand or walk too long or else her old knee injury will act up. Don't wait tables if you have a pre-existing injury. I brought her an ice pack and just the slight movement in her leg would make her spasm out in pain. Boss man came up behind me and asked her if she had used drugs before. She said she quit and walked out screaming / flailing around / crying all the way to the back exit. Turns out she was going through withdrawals well anyway. Besides my own experiences, which there were plenty, these were just some of the instances that came to mind. Some tolerated the pain because of their resolve. Some broke down to get that disability pay. Is badass and stupid about the same thing here. I've done two not so clever things. Neither was appreciated by the medical staff involved. Firstly, I dislocated my right knee. It went really bad, and it took a piece of the bone with it on its way out. At first I wasn't allowed painkillers as they were unsure if they had to operate or not. Once they decided against it, I was offered some. By that time I felt used to the pain level I had. Everything took ages before I was about to get the cast on, and I just had to pee. Got to loan a couple of crutches as I wasn't allowed to put any weight on it. Got into the bedroom okay. Managed to sit down. Getting up was hell with only one usable leg, and trying to keep the other straight without any weight or muscle tension on it. Got up, opened the door, and was spotted by a nurse holding this little old lady trying to help her to where she had to go. Sees me and just stops. "You, young lady, stay there. Don't move an inch. I'll come back for you shortly." Me. I waited until she couldn't see or hear me and started walking again. We are doing really well until I was spotted by my mum and a few other nurses. Total commotion. One ran away coming out with a stretcher. Two were holding me firmly in place. I still claim that I was doing fine. I was 15 at the time. Secondly, a year after I finally had that knee operated on for dislocating all the time, I got the scar redone as it hadn't healed nicely. Got strict orders not to bend it more than 90 degrees for 3 weeks, I think, to not risk it splitting open. It is about 20-30 centimeters long, so understandably, second weekend I decide I've been calm long enough. Take my bike to a party across town. We end up going out on the town. I of course wear my 10 to 15 centimeters plateau shoes. End up missing a step down to the dance floor. I fly out in the middle of a circle of guys. See, idea in hand. Managed to get my thumb up over the opening. Yeah. End up with my left ankle sprain. Well, not bad. Give me a minute and I'll walk. But oopsie, me right, the one I wasn't allowed to bend. That foot is under my ear behind. So I can't get up. The guys lift me to the stair. Give it 2 minutes and go out to a bench with a bit of better lighting. See the blood running. See a friend. Ask them to go get the manager for the night. Ask if he's got of those leuco strips. He doesn't, but he got some band-aids, but recommends me to go the ear. I clean up, patch a few band-aids on there. It was only about 2 to 3 centimeters that opened up, and went to the bar. Best, worst part. Riding my bike the 20 minutes home, got a ride to the ear the day after. That told everyone, told you so. Now is at least got a good night of partying out of it. I was on a day trip to a city a ways away from where I lived. I had spent most of the day feeling kinda sick to my stomach, a bit of diarrhea and such. It happens. Anyway, as it gets later in the evening and I start getting in my car to drive home, I begin to feel an awful soreness in my right testicle. Over the next few hours driving home in the dark, it felt like I was getting kicked in the testicles by a pair of steel-toed boots. I'm fairly certain that I was hallucinating car lights ahead of me at some points of the drive. Anyway, I wasn't even going to go to the hospital, because I live in America and the air is faking expensive. But after getting back to my apartment and trying to lay down, it was bad enough to where I knew I wasn't going to get sleep. So I get on the internet to try to do the WebMD diagnosis, and it comes back with appendicitis as the top result. Now, I'm fine with just letting pain fade out after a while, but fuck if I'm going to risk an appendix bursting, because I live alone, and if shit went really wrong no one's going to be there to call an ambulance. Luckily, I lived a mile down the street from the hospital, so I drove myself there at probably 2 AM. The air waiting room is basically dead. I tell the nurse at the desk what's up, and get shuffled over to the other nurse to take my information, which they ended up losing my insurance information. Yay me. Eventually I get called over to get TRIG evaluation. They're basically going through a differential diagnosis of appendicitis or testicular torsion or kidney stones. Or the really fun causes of pain. They end up asking for a urine sample. There's nothing quite like suddenly having red urine. Anyway, after a court and an ultrasound, it ends up being a kidney stone. Incidentally, that same stone took for faking ever to get out, mostly because it ended up getting stuck in the end of my penis and had to be taken out by a urologist, basically just tweezed out. Really, other than one other really bad afternoon, where I walked to the hospital got some painkillers, and walked back. The kidney stone didn't really hurt too much. Anyway, the other fun experience I had was a nasty tooth/bone infection that ended up with a night of the worst tooth pain ever, followed up by a morning with slightly less tooth pain, but half of my face swollen and any pressure put on it going straight into a ball of pain in one of my incisors. At least the tooth died kinda quick, so after another day or two there wasn't a need for pain medication until after the first attempt at a root canal, where the nerve was still swollen up like crazy and just couldn't be cleaned out because the anesthetic did nothing. Wrecked my motorcycle a little over 2 years ago while avoiding an animal in the road. Slammed on my brakes and totally slid on the pavement face first with my motorcycle on top of me. I was all geared up, except I decided to leave the riding pants off because it was a quick 10-minute ride from work to home. Big mistake. My jeans shredded and the skin at the top of my knee burst open. I called my boyfriend who came and got me. I was a block away from home. Me being the total bad as that I might told him to go home and we'd take a look at it, that it didn't feel that bad. He proceeds to turn on all the interior lights and tells me to show him my leg. I moved the shredded chain material aside enough for us to see a large wound, fat, and my bursa sac sitting there completely exposed. He noped my ass directly to the hospital. Took about 20 minutes to check in, an hour to get seen/sent for x-rays, and then another hour before they sent the ear doctor in to help with morphine and the stitching. At this point my x-rays came back looking just fine. The crazy technician looked at me and said, "You're handling this all quite well. I mean, you barely seemed phased." I told him, what can I do about it now? I already messed up. No point in sitting here whining about it even more. Once the stitches started I got the shakes pretty bad. They have me a bit more morphine and I perked right up.